respond with, there's nothing you can do. Take this gabapentin. If that doesn't work, we'll increase the dose. If that doesn't work, we'll refer you to the neurologist. He might do some studies and then he'll up your gabapentin, and you just end up frustrated. So what most Americans do is we go online and we just say, hey, Google, can neuropathy be reversed? Because we're frustrated and we want to know what's out there other than what my doctors are saying. So let's turn this here, make it nice and big, and we'll just go along with this together. Let's open that up a little bit there. All right, so here's one thing that's really powerful. Now we always have to be careful with Google and Bard and ChatGPT because they don't always provide the right resource and the right answer. But let's get a close look here. So here I go. I already put it in there. Can neuropathy be reversed? Click enter. Right off the bat, let's see what we have. Atlantic integrative neuropathy. So restore normal nerve function. With our safe and effective therapy, we can help reverse their symptoms and find relief. We're going to talk about that. Are you wanting to reduce your symptoms or are you wanting to reverse it? See, reversed, treat symptoms. Those are two different things. Now, how about this? A diabetic peripheral neuropathy. Get treatment info, request to receive more information. Doesn't say it can be reversed. Now, these are all sponsored, you guys. You have to watch out for the sponsored ones. Let's see this one from Health Corner 24. Best way to reverse neuropathy. Reverse cellular neuropathy. Thousands of people already relieved their neuropathic pain and nerve damage with one method. Watch how you can improve your nerves with the natural method. Again, relieving symptoms is what that's talking about. How about an Opta-Balance Life, your neuropathy guide, foot treatment. Learn how you may potentially enhance nerve health with a natural approach. All right, but let's go into what we often see. So Johns Hopkins, right? Very well-respected medical facility. Usually a peripheral neuropathy can't be reversed, but you can do a lot of things to prevent it from getting worse. If an underlying condition like diabetes is at fault, your healthcare provider will treat that first and then treat the pain or other symptoms. So nobody's really talking about reversing it other than this sponsored one right here. Watch how you can improve your nerve health. Let's go lower. What does the Florida Medical Clinic have to say? Whether or not neuropathy can be reversed depends on the cause of the nerve damage. All right, well, that gives us a little bit of hope. The Florida Medical Clinic says whether or not it can be reversed. So they give us a little bit of hope. That's exciting. How about Sunshine? I think that's what that is. Podiatry Associates. Yes, neuropathy can be reversed, and here's how. Yes, neuropathy can be reversed. Here's how. Some things are irreversible. I like their analogy. Like a tree that has been felled and cut into lumber cannot be reversed. And I went in here earlier and it said, like eggs that are scrambled, you cannot reverse that. But they're giving us some hope. So that's another medical center. So that's really good. Cleveland Clinic, we've all heard of them. Can neuropathy be reversed? Peripheral neuropathy may be reversible in some cases, but many factors influence whether or not this is possible. Hey, that's great. So they're giving us hope. This is a new thing. Usually I just see nope, 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 no, it can't. How about WebMD? For example, peripheral neuropathy caused by a vitamin deficiency can be treated and even reversed. All right, I'm liking that. Maybe you have a vitamin deficiency. WebMD talks about, hey, if that's what you have, then you fix the vitamin deficiency and it may be reversible. So that's exciting. What about Healthline? Diabetic neuropathy is common and can't be reversed. Boo! So they say it cannot be reversed. So I think they might be a little bit behind the times. National Institute of Health, can VEGF reverse diabetic neuropathy? Good glycemic control, the only proven treatment for diabetic neuropathy in humans, is known to prevent the development or halt the progression of. All right, so they're not saying that it can be reversed, but it's saying you can stop the progression. So, all right, National Institute of Health. Let's see, Upstep causes neuropathy that can be reversed. There's another one that gives us some excitement. Current research evidence suggests that nerve damage is partly reversible. Great! I've done the research as well, and I found that it can be reversible. So let's see, Diabetes UK. One last thing and then we'll move on. Let's see, no, diabetic neuropathy cannot be reversed, but the symptoms can be treated. Once the nerves have been damaged, they cannot repair themselves. All right, let's talk about that. So push this away. I'm going to move you over here. Right there. There we are. When Western medicine and pharmaceutical companies say it cannot be reversed, they're right. Because the only thing that Western medicine and pharmacology does, meds, is treat the symptoms when it comes time to peripheral neuropathy. So can neuropathy be reversed using medicines? No. No, it cannot. Can you treat symptoms and can you become more comfortable with those medications? Yes, and many people can. But that's not the question, and that's not the intent of this video. Is can neuropathy be reversed? Not just treating a symptom, can it be reversed? Can nerves heal? That's really the question. In over 15 years of doing this neuropathy, we have ascertained an 85 to a 90% success rate. Listen, my only goal for this video is to provide hope for you. If you want to call our office for learning more about your condition, feel free to do so. But if the only thing you get out of this, from what we just watched on the videos and from what I'm explaining, if all you get is, hey, it might be possible, then I've done my job, okay? But you should know that most cases of damaged nerves, neuropathy, can be healed. And why is that? It's because the body is genetically designed to heal itself. Why is that? It's survival of the fittest. It's becoming adaptable to our environment. And let's face it, if you have numb feet and you're having balance issues and it feels like your feet are burning or in a campfire, gee, that's really hard to survive. The body recognizes that, it knows that, and it sends signals to you, ouch, this hurts. Take your feet out of the campfire. Okay, wow! But if it's not a campfire there, if it's the nerves are damaged, then you should know that the body is doing all it can to repair those nerves. The first thing we need to do is stop the offending activity. Okay? So if it's diabetes, too much blood sugar together with insulin resistance will literally damage the micro vessels, the arterioles and the venules. It'll damage those, and if the nerves don't get blood supply, they die, and when they die, they hurt. So going all the way backwards, if diabetes is the cause of the nerve damage, then we need to figure out the cause of the cause, because diabetes type 2, in particular, diabetes type 2, is a lifestyle choice, right? What we eat and how we exercise or how we don't exercise. So if diabetes is the cause, then if lifestyle is the cause of the cause, then we need to change lifestyle. I have lots of videos here. We'll put some links down below, but particularly diabetes and other lifestyle related things, including vitamin deficiencies, those can be corrected. Now, one of the sites, I forget who it was, we just watched it right here, but one of the sites said it depends on the damage, and if you can fix the diabetes, then you need to do that. But what ends up happening, whether it's the diabetes or the chemotherapy or vitamin deficiency, you still have damaged nerves. So you need to first stop the offending activity, right? And so stop damaging them. And then we need a strategy to repair those nerves. And for that, we'll make sure that we put some links down below of other videos that I've done. So we have a lot of videos on understanding neuropathy, how it occurs. We get down to the nitty-gritty microscopic level on other videos showing you how nerves are damaged. You might be interested in seeing some videos on that. You might be interested to learn what is this peripheral neuropathy, where I break it down to that. We also have a ton of videos on this channel offering treatment options. I recently did one where I reviewed the top, it must have been at least 10, the top 10 medications that are used in Western medicine, and I go through and I give it a fair shake and I talk about which ones seem to work better than others, and I also will cover side effects and also the limitations of that. I've done other videos on natural remedies that can actually improve circulation and other ones that stimulate the nerves to grow back in there. And again, check below in the description for those videos there. It's really important with neuropathy, like most conditions, for early intervention. So if you know someone, or if you are feeling some burning or numbness or tingling and it's not going away, you should really seek advice. Try and find someone who knows what they're doing. It's best to find a guide who's actually guided people to reversing the neuropathy. And if your doctor says there's nothing that can be done, all I want you to know is there are things that can be done, and I want you to continue searching around and find someone who's actually done it, okay? I use the analogy all the time. If your goal is to climb Mount Everest, you're not going to hire the guide who says it can't be done. You don't want a naysayer saying that. You'll never get to the top. You want to find the guide who says, yes, it can be done. I've done it. In fact, I can show you exactly how to do it as well. So, the importance of early intervention, like everything, even at the earliest sign, you should get it checked out. There's some cases that I've not taken on because their neuropathy is not bad enough. And those are exciting cases because I could say, listen, I got good news and bad news. The bad news is I'm not accepting you into the program. And the good news is because you're too early on, but here's some steps that you can do. I might give them a copy of my book. I might give them a recipe little book that I wrote called The Paleo Kitchen. I might say go to a physical therapist. Maybe you need a chiropractor. Maybe you should check an endocrinologist, but we'll give advice. Those are the great cases when I can catch them before they even need to get into a program like mine. I have other videos, as I said, on lifestyle changes. We can check those out. All of this research is scientifically backed. We have research on that. I'm approaching 300 videos, so there's a lot of them there. But again, circling all the way back around, can neuropathy be reversed? Yes. Even Google agrees, all right? Even some companies or medical institutions are saying whether or not it can be, that provides hope. That provides hope. There is a possibility. Keep your chin up. Keep searching. If you want our help, reversingneuropathy.com is the website. We have so much resources on there, all of them free. I do a webinar called Reversing Neuropathy. I have a course, it's not quite out yet, but I have a course called Reversing Neuropathy 101. It's over 8 hours of content going into the science and the treatments. That's on the website. The Paleo Kitchen should be on there as well. But we have a lot of resources, free resources for you on our website. Lastly, as I mentioned before, if you want to consult with one of my team members to see if your type of neuropathy is reversible or not, then just reach out to us at reversingneuropathy.com. Well, again, I hope this brings you hope. That's what it's all about. If you watched this far, you should have garnered that neuropathy is reversible. It's possible to reverse this and put this thing in your rearview mirror. I hope this helps, and I hope you have a great day. Keep your chin up. Help is on the way.